on the effectiveness of diabetes treatment. A blood pressure monitor data not only for diabetes but to monitor any treatment progress, or simply to be aware of the state of health. Blood pressure on both arms and blood sugar levels should be measured before meals, 30 minutes after meals, and 2 hours after meals. The three values inform us about the three fundamental equilibrium criteria of Qigong therapy, a branch of complementary medicine. Energy equals systolic mmHg, alimentation equals diastolic mmHg, pulsation equals BPM, number of beats per minute. If the three-digit numbers are within the limit of the age-referenced blood pressure values, the person would be in good health. If sugar is functional, i.e. it provides energy and heat, then blood glucose, temperature and pH would be aligned in the same direction of progression or regression. The pulsation provides information on the sugar content and the state of heat or cold. Pre-meal measurements, tensions measured on the left arm before meals provide information of the stomach. Case 1. 110 millimeters of mercury, 80 millimeters of mercury, 75 BPM, 36.5 degrees Celsius. Normal. Case 2. 110 millimeters of mercury, 80 millimeters of mercury, 85 BPM, 38 degrees Celsius. Heat in stomach. High pulsation is normally associated with high temperature. These two values follow the same direction of progression. Case 3. 125 millimeters of mercury, 80 millimeters of mercury, 85 BPM. Temperature, low. Lack of blood. High pulsation means heat, but low temperature at fingers means internal heat. Cold outside and lack of glucose. Because of a lack of blood, the heart must beat faster to get the blood to the cells in time, which causes the pulse to rise. Even then, blood does not reach the tips of the fingers, which remain cold. Low temperature. Diastolic blood pressure indicates that food is not transformed into blood, but into fat due to a lack of glucose. In this case, the blood glucose level will be 100 milligrams per deciliter to 140 milligrams per deciliter, 6 to 8 mmol, and the pH 6. The value of pH 6 would be a precursor sign of cancer. High blood sugar level and low finger temperatures mean that sugar is not functional and therefore neither provides energy for digestion nor heat for the body. Blood pressure measured on the right arm before meal provides information of the liver. Case 1. 120 millimeters of mercury, 75 millimeters of mercury, 75 millimeters of mercury, 68 BPM. The sugar content in the liver is minimal, just acceptable. Case 2. 120 millimeters of mercury, 75 millimeters of mercury, 60 BPM. Low pulsation indicates lack of glucose and cold to the liver, but the liver does not lack blood. The low temperature on the finger confirms the lack of sugar. Measurements 30 minutes after meals. Tension in the left arm after meals. 120 millimeters of mercury, 80 millimeters of mercury, 75 BPM, 36.8 degrees Celsius per pico Henry 7. Blood glucose 140 milligrams per deciliter to 180 milligrams per deciliter, 8 to 10 mmol. The meal contains glucose. If the temperature is low, below 35 degrees Celsius, the food in this meal has no glucose. Measurements 2 hours after meals. Left arm tension. Case A. Indigestion. Food remains in the stomach. Low temperature. Low pulsation. Blood sugar of 140 milligrams per deciliter, 8 mmol, has risen to 180 milligrams per deciliter, 10 mmol. Food remains undigested in the stomach, but sugar in food oozes out and flows to the small intestine. Passes into the bloodstream, raising blood sugar to 180 milligrams per deciliter, 10 mmol. This excess sugar is transported to the liver to be stored in glycogen, but is not functional to provide energy for digestion and heat to the body, so the temperature is low. There would be esophageal reflux due to indigestion. Case B. There is digestion. but blood sugar remains low at 140 milligrams per deciliter, 8 mmol. Case where there is drowsiness after meals because the body has taken the amount of glucose from the heart to digest the food. After digestion, the liver releases glucose from glycogen to restore glucose to the heart. The pulse rises to 65 to 70 bpm. Before meals, 130 millimeters of mercury, 80 millimeters of mercury, 60 bpm. After meals, 120 millimeters of mercury, 75 millimeters of mercury, 65-70 bpm. If the person does not consume sugar, there would be no glycogen reserve. The lack of sugar leads to low pulsation, 58 bpm, cold to the body, fatigue, heart failure, and indigestion, which will later cause acid reflux. The pH would be pH 6, a precursor sign of cancer. 120 millimeters of mercury, 75 millimeters of mercury, 75 millimeters of mercury, 58 bpm. Case C, indigestion with esophageal reflux. Blood sugar is high. 180 milligrams per deciliter, 10 mmol. Yet there is indigestion. It is the sugar that oozes from undigested foods into the small intestine and then enters the bloodstream, raising blood sugar level. This sugar is not the functional sugar from food digestion. This is why blood sugar level remains high, but the finger temperature is low. Pulsations on both arms are low. Stomach, 68 bpm. Liver, 65 bpm. There is cold to the liver, which will carry cold blood to the heart. The pulse would be low. The blood circulation is slow, predisposing to erratic pain. If the stomach pulse left drops to 60 bpm, food densification and agglomerates formation in the stomach would occur, resulting in bloating, abdominal swelling, and a decrease in pH 6 to pH 5, eventually leading to stomach cancer. Case D, excess heat, accelerated digestion after meals left, 140 millimeters of mercury, 85 millimeters of mercury, 90 bpm. Right, 130 millimeters of mercury, 80 millimeters of mercury, 98 bpm. Temperature, 38 degrees Celsius. This is the case of excess heat. The temperature and pulsation are all high. 2 hours after meals left, 120 millimeters of mercury, 70 millimeters of mercury, 90 bpm. Right, 115 millimeters of mercury, 68 millimeters of mercury, 98 bpm. Temperature, 38 degrees Celsius. Blood sugar, 210 milligrams per deciliter, 11.5 mmol. Indicates a high pulse and high temperature. All values decrease, except for pulsations and temperature. It was the excess heat that consumed all the food. After a meal, the stomach is full, but empty 2 hours later. Food is burned but not processed into blood. Liver lacks blood. The liver transmits heat to the heart, thus elevating the pulse. The heat in the heart is transmitted to the lungs, giving thirst, constant hunger, and slimming, because the food is all burnt, is no longer nutritious. B. Effects of insulin. In all cases of diabetes, treatment with insulin injection, the pulse and body temperature always remain low. The blood circulation is slow. The blood is cold. All this predisposes to obstruction of circulation by narrowing of blood vessels, formation of blood clots giving erratic pain, strokes by obstruction, flaccid paralysis or deviation of the mouth. A sugar-free diet does not allow the transformation of food into blood and energy, but into fat. The person becomes obese but still without strength. After insulin injections, blood sugar levels drop, but there is always a rise in blood sugar levels. A sugar-free diet and insulin injections deprive the body of sugar. Therefore, to maintain the functioning of the heart and nervous system, the body must draw sugar from fats, muscles, bones, giving muscle wasting, weakness, memory loss, osteoporosis, and finally to cardiac arrest, when there is no place left to extract sugar. Only the internal insulin, secreted by the pancreas of the same genetic code as the body, can get food into the cells. External insulin cannot bring food into the cells, glucose, protein, lipid, oxygen, but can only carry sugar to the liver to be stored as glycogen and fat. the cells are still malnourished, will die and would lead to cancer. External insulin disrupts the release of internal insulin from the pancreas. Retention causes cell nodules and pancreatic cancer. It is the decrease in the blood glucose reference that determines diabetes, which sets the extent and phobia of diabetes. Treatment approach. According to Qigong therapy, branch of complementary medicine, the tensiometer values for diabetics with insulin injection are 140 millimeters of mercury, 65 millimeters of mercury, 60 bpm. It is a case of low pulsation, lack of glucose, heat blood, with apparent high blood pressure. To treat, the pulse must be raised by taking glucose to get energy and heat of the body. The pulsation and temperature will therefore rise. Reform the blood by consuming glucose with powdered proteins sold in some specialty stores. Protein and glucose together promote blood formation. Diastolic pressure will rise. Apparent systolic pressure will drop to normal. Practice exercises to stimulate the production of internal insulin by the pancreas. Insulin is produced from dietary protein. An unrestricted and varied diet would be required. It is only at each food entry that the pancreas produces insulin in the following sequence. Dietary proteins transformed into proproteins 100%, then into proinsulin 20%, and finally into active insulin 80%. At all times, there is no insulin in the body, but there is proinsulin, which would be converted into active insulin as soon as there is appropriate stimulation, exercise, food entry, mental state.